So we talked about neuropathy, you mentioned fibromyalgia, both just have to do with nerve pain. What happens during chiropractic adjustments that can regenerate those nerves? What's going on to maybe turn that condition around through chiropractic visits?
Yep. So a lot of people, Scott, we always look at their low back, especially if they have neuropathy in their feet. But if they have it in their hands, once neuropathy starts getting real bad, they'll start to feel it in their hands. It typically starts in the feet and the legs because it just by default your feet get the less blood flow. They're the furthest from the heart. So we always look at the low back, and a lot of them will have what's called degenerative disc disease, arthritis in their low back, which is essentially your discs as they break down. Your discs keep the space for the nerve. It's called a foramen. So as the disc breaks down by default, that nerve starts to take on more and more pressure. Thus, 99% of them have back pain. But then it can start to affect everything where that nerve goes. So a lot of them it's two and two. We got to address their low back. So we use adjustments. I mean, as chiropractors, we're trained in adjusting the spine, analyzing the spine. If you can free up that nerve even a few millimeters, you can change someone's life. And if it's real bad, like a lot of my patients, unfortunately, have already had back fusion, we use what's called spinal decompression. The latest advancement as far as you basically distract the spine and it moves their lower half back and forth to just gently open up those nerve roots, which works very well. So that's the chiropractic side of it. Now, as far as the other, how do we get more blood and oxygen? We use infrared light therapy. Studies have found if you expose the tissues to a certain wavelength of light, it will cause the blood vessels to create what's called nitric oxide. It's a vasodilator. What does that mean? Well, it opens up the blood vessels that are existing, which essentially floods the feet with blood. What does that mean? Well, more sensation, less pain, and anything in your body needs blood to live, more oxygen. Another thing we do is we use a device that basically, I found a company that patented the signal your brain runs on, and essentially your nervous system is electrical. So if you can use electrical devices to essentially wake those nerves back up. So there's a device, a medical device that patients we actually sell them, that will help to calm the overactive nerves, the nerves that are misfiring, pain, tingling, burning. But it'll also, on the same token, start to kind of force the ones that aren't doing their job to work. The numbness, and a big one is balance. A lot of these people come in, they can't feel their feet, which you and I take for granted, but when you can't feel your feet, you can't drive. Just walking onto a slippery surface becomes an issue, and number one cause of death over 65, unfortunately, is a fall. So that's a very scary thing. I'd say half of our patients with peripheral neuropathy they have gait or balance issues. Many of them already fall on a regular basis. They kind of just accept it. So.